iris edge شو يسموها؟ ماخذين عيون انتم بعدكم they call it upper limbus, the upper eyelid edge and lower eyelid upper limbus or superior limbus and inferior limbus. The upper limbus I should never see it. أشوف. It should be covered by the eyelashes. Okay. So I'm going to ask him to look at patient. I look at the finger of the pain and move it upward or downward. They should be covered. When I do it once, it will be covered by hyperthyroid or hypothyroid or euthyroid. كلهم. But how can I elicit lid lag? I should repeat it many times. Look at it many times and I look to the upper or superior limbus with the coverage or by the superior lashes. All the time it is covered. In patient with hyperthyroidism, there will be a delay. تنزل الاي بول وراها يرجع الجفن. Okay? So in patient with lid lag, the eyeball will descend, then followed by the superior lashes.
بس الريتراكشن يكون مسحوب هو
الليد ريتراكشن مسحوب. مسحوب عيونه. يعني هنا نسوي عملية تجميل؟
لا الابر اي ليد يكون مسحوب للاعلى يعني اللي
يعني صاير فوق البني.
لا اللي بيت المصل
خل احكي هي بس هاي ظلت. خل احكي.
الريتراكشن.
The lid retraction also what happens? I should stand a little bit away from the patient. Sorry طبعا and ask him to look for something away. باوع على الحائط، باوع على ذاك البعيد. Why? To make the pupil a little bit dilated and maximum size of the sclera of the iris. أقول له باوع بعيد وأنا أجي أباوع. Your hand should be upright and look for something away. Normally, the superior and inferior limbi should be covered by the superior and inferior lashes respectively or respectively. يعني باوع الجاهن اثنيناتهم covered. ولو انت عندك واحد منهم اوكي ثاني شوي زايد. انت ما عندك زفان مصيله ما عندك.
اليسار؟ هذا اليسار.
اي
الجفن شوي اكبر من
بس الجفن ماصل شويه اكزوثالموس؟
لا
راجع يعني؟ يا نعم زين من اجي اباوع شلقه the superior and inferior limbi should be covered by the superior and inferior lashes. In cases of exophthalmos and lid retraction, usually the inferior in the first degree or minor degree, the inferior will be retracted, then followed by the superior. ليش? Some sort of sympathetic hyperstimuli of the lashes. هذه eye sign. So what is the difference between exophthalmos and the proptosis? What is proptosis? Protrusion of the eyeball. But what is the difference between proptosis and exophthalmos? In exophthalmos, it is a condition that strictly thyroid diseases and has a proptosis superadded by lid lag and lid retraction. إذن الإكزوفثالموس شنو؟ هو proptosis بس لازم وياه lid lag and lid retraction. لأنه إذا بس proptosis بس protrusion of the eyeball I call it proptosis only. وين؟ هاي اللي سولفنا عليها intraorbital damage, intraorbital tumors, masses, retroorbital damage, retroorbital masses, edema. ذيك condition اللي يصير فيها protrusion وتظل الادراك والتراكشن ما موجود. من يصير وياها due to sympathetic hyperstimuli we'll have exophthalmos. ما اقدر اقول exophthalmos على غير diseases. هذه شنو هي؟ face or eye sign of a patient with family. بعد شباور chemosis يعني looks for the mouth. If I found xerostomia, that will happen due to patient with the hyperthyroid. خلص الفيس. شباور بعد الليك يعني أطفال من الفيس قبل الليك شالج سمو موجودة النك نك راوي النك والله. أمين. هسه اجي for patient with thyroid disease I want to examine the neck. مش القى بالneck. Also I should stand away from the patient. Inpatient for examination وهاي يوقعون بيها معظم الطلاب حتى من رحنا امتحاننا رويال كوليدج هم رادوا يوقعون بيها. When you want to do an examination of a thyroid, you should make a distance between the patient's back and the wall أو إيش أو كانوا مخلين سدية دي قدام المريض. لازم أكو مجال ورا المريض فاضي. خوش؟ نعم. Because I should do it posterior. لازم. وبعد شو أخلي؟ أخلي cup of water beside him. او مرات ايضا هم بالرويال كوليدج هم سووا لنا تيست خلوه قدامنا معون تمه كاب اوف رايس. لازم اكو something to be put in the mouth for swallowing. اوكي اجي لازم اكو ووتر مو هذاك الكحول مي زين اخذ and I should look for the patient from away. Also ask him to be in a straight forward and look for something away. And look for the neck. If I find something, an examination of the neck اعتيادي. شكو بالneck, I found a swelling in the center part of the neck in two lobal, لو not lobal بعد هو شوف انت شنو ايش تلقى one lobe, two lobe يا منهم involved يا منهم الا تحكي. With the neck veins, if I have a neck veins اكو لو ماكو. بعد scar اكو لو ماكو. Ecchymotic spots. بعد سولفنا عليها. بعد شباوع بالنك. Ask the patient to have a cup of water or have a bolus of food and to hold it in his mouth. Then I ask him to swallow. تقدر تبلع عليك؟ بعد ما So his hands, his neck is moving and the thyroid cartilage, this is thyroid cartilage, and the thyroid cartilage also moves with the gluteation. So why?
So if it is thyroid, it will move with the swallow.
ليش move with it? Yes, because the attachment of the thyroid gland to the protracheal fascia that hold the esophagus and trachea and make it move with the swallowing. So if I have a thyroid and I ask him to deglute or swallow, I have it move. Can patient with thyroid swelling do swallowing and we have no movement of thyroid?
If it was attached,
الجواب is شنو أول شيء can or cannot? Yes. Where? واحدة من عندهم malignancy. ليش؟
fixed the skin.
Because of invasion of the malignant thyroid tissue to the nearby structures. واحد. بعد lymph node احنا ايش حكينا سؤالنا؟ انت هم حسين ما بشعوده. انا ايش حكيت؟ قلت thyroid swelling moves or not moves. Can I have not moving thyroid? Okay. وين؟ بالمالجنسي. بعد thyroiditis in the same place. شوف.
Cysts.
A huge goiter. If I find a huge goiter, it cannot move. فشي ثقيل، شي حركة. وصار هالكبرها ولابسة منها ولابسة من هنا. In a huge goiter, it cannot be moved with the swallow. أكو بعد؟ إي أكو. وين؟ In which place? In retrosternal extension. If I found the retrosternal extension, usually make it fixed. So when I want to take a swelling, it will not move. بعد. Recurrent. And recurrent goiter because of the presence of a scar and the previous breach to the pretracheal fascia, so I have no movement of thyroid swelling. So these conditions, I have no movement of the thyroid swelling in the swallowing maneuver. كملت? I should express it by inspection. If I have found the swelling, على swelling كل شيء أحكي. Swelling size, site, surface, movement with the swallowing, بعد color of skin above it, بعد consistency من عيني شنو هاي عيني صلوات سونا بعدني هسه قلت palpation بعد هسه بدي احكي من بعيد. بدنا انطي features of any swelling in the neck just by look. ماشي. زين. شو اسوي بعد؟
Ask him to
I
stand
should-
out.
ورا ما سألت على deglutition I should look for the what? neck veins whether present or not whether happens or not happen. بعد شو اسوي؟
دكتور عقله بروترود التانك اذا اكو ثايروبلاسم سيست همات
اوكي no problem can put it. بعد شو اسوي؟
Lymph nodes.
ليش ما دواوعها؟ انا دواوع. ما اقول لكم حاضروا شلون يعني؟ I should ask him to what? To elevate his hand and catch his fingers above his head for at least 10 to 20 seconds. Why? And what will happen in patient with a thyroid?
طبق يعني
شنو هي؟
يعني اذا مثلا ركبتها مطبق
إذا عندها ماس يعني بيها. إذا عندها ماس بيها.
طبقة.
او
If I found or if I have a retrosternal extension and I make my patient elevate his hand above his head, I make the superior end of the thoracic cage on its narrowest size. راح اخليها اضيق ما يكون من اخليها هيك. So if I have a retrosternal extension of the thyroid
يحس
gland,
بديسنيا.
it will press over what? Over
Trachea?
the major veins in the neck, on vessels in the neck. ويوجوالي أول شيء يتأثر منه بالvessels, الفين والارتري. إذا أخذ pressure الفين because of its low pressure. وأنا أخليها in its narrowest place, it will press on the nearby veins, and what will happen? Make the face and the neck in a plethoric color. راح يصير لونه أزرق. If he have what? If he has a retrosternal extension. شو يسموها هاي الساين أو هذا التست؟ Pemberton test. شو نسميه؟ Pemberton test. Pamburson. Pemberton test. So ask him to elevate your hand above your head. To see what's happening above and catch it. Is there any change? For 10 to 20 seconds. There is no change. Thank you. هذا Pemberton test. بعد شو اسوي؟ اجي افحص by palpation. From front or from the back?
From the back.
From the start, from the front. شو افحص؟ tracheal position. شلون maneuvers اللي موجودة؟ Either one finger or two fingers. أجي about one finger, ask him to look forward and straight his neck and press in the base of the neck to see the trachea. Trachea should be what? Central or deviated? Central. So I should put my finger between the sternocleidomastoid muscle, the sternal head, and the trachea in that way, then in that way. Okay. It can be pushed freely this side and this side. If it is deviated from one place to another, what will happen? I cannot push it because of trachea. Okay? هذه what will examine in front. بعدين أجي وين؟ أجي على الباك and I examine my patient's swelling. طبعا an examination of his swelling is the same in the goiter. Anything in the neck I should examine by what maneuver? By a relaxing position. شنو relaxing position? Make the patient head tilt to the side that I examined. So I ask him to tilt his neck on that side and press the other one and examining by that side. What I found. I found a mass about 3 by 4 cm, globular surface, rounded, not tender, and not hot in relation to the nearby structures. And also ask him to swallow, and to see whether it is move with swallowing or not. I can't get above it, I can't get below it, okay? And then relax, and do the same thing on the other side. Also press by the opposite fingers and examine by that finger, see what happened above it, what happened below it, the skin condition, and globular surface or not, the size and the edges and endings. Okay? هذا شنو؟ الماس. وأنا هاي وقفتي. شو أسوي هسه؟